The COVID-19 infection rate is declining in Belgium, but COVID-19 fatigue is growing. So many months of isolation, so many masks.
For me, it's like something really oppressive.
Thibault, who doesn't want to give his last name, despises social distancing and defies the rule to wear a mask in downtown Brussels.
If I enter in a shop, if I go in the metro, okay. But if I walk alone in the street, no, that is really too much.
And Thibault is hardly alone in his opposition. Michael Verstraeten, who represents the protest group Virus Madness, says no one should have to follow restrictions except the most vulnerable.
How many people would die if we would not take any measures at all at the moment? We don't know, in fact. We have no idea.
New research shows just 1 in 3 people surveyed in the Dutch-speaking part of Belgium still supports the safety measures. That's down from more than 80% in March when the pandemic first hit here. University of Ghent professor Martin van Steenkiste, who led the study, blames poor official communication for the dramatic drop in motivation. He says it's been a wake-up call for authorities to pay more attention to people's state of mind.
I don't think we have sufficiently been informing people on the consequences of their behavior for them to take a wise decision.
And now with the 1st of September comes the traditional rentrée in Belgium, a return from holidays back to work and school. It could be a toxic coronavirus cocktail.
We're quite worried.
Leading Belgian virologist Steven van Gucht says experts are stealing for a potential September surge. He nonetheless agrees people should be given more information about actions and consequences, and then more autonomy.
So people can have some freedom to choose what they think is appropriate for their situation, and they can adapt their behavior.
But are people so sick of restrictions by now, they won't follow them? Van Gucht believes most do comply. I don't obey them too strictly because it's very difficult, but I try anyway.
I feel much safer wearing it. We must do it all together.
But skepticism is clearly growing. In recent days, open letters have been published in Belgian media, signed by hundreds of experts, including doctors, scientists, and researchers, suggesting the strict measures should be reviewed to see if they're stopping the virus or just the vitality of everyday life.
And we are joined now by WHO spokesperson Dr. Margaret Harris. She's joining us from Geneva. Welcome to the program, and thank you so much for joining us. How do you think fatigue from coronavirus measures could impact infection rates?
Certainly, fatigue is something you do see with an outbreak like this. And one of the problems is people were so fantastic about accepting very extreme measures quite often. And what people think is that, okay, we've done this, we did our bit, we were fantastic, now we go back to normal. Now, the problem is normal is what got us into this mess in the first place. We have to learn to dance with the virus. Yes, we need to be able to resume our society. Yes, we need to be able to resume our human activities, but we've got to find ways to do it safely. And so people have to be listened to. The things they are raising, their concerns do have to be listened to and responded to, but always with that overarching idea. This virus is in our community. It's killing way too many of us. We have to learn to live safely.
So then concretely, what does the WHO recommend? Because, I mean, we have seen thousands taking to the streets in recent anti-corona protests.
So we particularly recommend don't be clustered together, especially in indoor areas. So my Director General referred to the triple Cs, and they're the triple Cs of things you avoid: crowded spaces, closed spaces, and close contact. So the close contact is the hard one because we as humans love to be together. We are classic herd animals. We feel safer, we feel more comfortable when we're in large groups, but this is exactly what the virus is exploiting. So if we're going to be smart about this, we really still need to keep the distance and try to avoid being close together. Crowded spaces indoors, particularly indoors with poor ventilation.
We have autumn about to arrive here in Europe, other parts of the Northern Hemisphere. Talk with us a little bit about your level of concern, especially as we head into the colder weather. What is the science saying right now? What can we potentially be bracing for?
Yeah, so it's two things. The colder weather makes us go indoors. So those 3 C's I was talking about, they become more attractive as the weather gets colder. And we can already feel the cooling of the air. The autumn really is arriving. So if we're going to spend more time indoors, we have to look at ventilation and we have to look at how we can space ourselves. If that's not possible, that's why the face coverings are being recommended. So there'll be a limit on the amount of viral load that's floating around. We are seeing early signs that perhaps there's a better chance of people not getting as ill if they don't get such a big dose of virus. So all these things we can do to improve the ventilation, limit the amount of virus that's being spread, keeping the hands clean, keeping the environment clean, that will help us beat this thing.
So we should all go out and get sweaters because maybe we have to keep the windows open. Dr. Margaret Harris joining us. Joining us from the World Health Organization. Thank you so much. Well, now another place where there is resistance to anti-corona measures is Cameroon in West Africa. The government there has recently launched a mobile testing and awareness campaign. But as DW's Blaise Eyong reports, health workers are facing a tough task because some people still don't believe the virus is real.
The streets of Cameroon have never been empty since the beginning of the COVID-19 pandemic. Social distancing doesn't apply much in daily life here. Some people like Maxel, a small trader, do not believe the virus exists at all in Cameroon. Ironically, he wears this face mask to appear on camera. But he does not think the coronavirus has entered the country.
There's talk of coronavirus cases in Cameroon, but we don't really see proof of these cases. In Europe, when you hear of the pandemic, you hear of hundreds of people dead from the virus. However, in Cameroon, we don't see that.
Those views are echoed by many people in this market in Yaoundé. The government has sent teams of medics across the city to remind the public about the pandemic and to encourage them to take free coronavirus tests. But the teams often encounter hostility and hesitation. Some people believe the pandemic is a government scam.
One of the main challenges is that we have to test the maximum amount of people possible because people are hesitant to get tested. As you have seen when we come around, some people mock us. They say we are part of a secret cult. They also say we're bringing the disease to them. So making people aware about this pandemic is a great challenge that we are working on.
14 kilometers away, the government has set up a mobile testing center. Those willing to be tested are brought here. 3 days into the operation, this unit has recorded 1 positive case. Good news for the doctors. The aim is to test, trace and treat in order to flatten the coronavirus curve in Cameroon.
We have had a number of people coming in to take the test. They all come voluntarily, and as the day passes by, the number of people who want to get tested is going up. We are now on day 3, and we have processed about 65 people who have come in for the coronavirus test.
Back in the market, these health workers say, the coronavirus exists. It's not over yet. Put on your face mask. Over and over. Cameroon has recorded close to 19,000 coronavirus cases with 410 deaths. It's one of the worst hit countries in Africa. But Marcel still doesn't believe in it.
They simply inflate the figures in Cameroon, and we don't see what they are talking about. All the resources to fight the pandemic are enjoyed by the wealthy, but the poor have nothing at all.
Despite the challenges, the awareness and mobile testing team still plans to extend their campaign to other regions in Cameroon. They hope people will take the message seriously to stop the dreaded coronavirus